Welcome to my channel. Today I will discuss the very well-known homeopathic remedy Bryonia. So today we will know how to identify Bryonia patient easily. We all know that excessive dryness or lack of secretion of mucous membranes is the most characteristic symptoms seen in Bryonia. Dryness of lips, mouth, stomach, intestine are seen. Even rectum and stools are also hard and dry as if burned. So, the patient wants drink in large quantities of water. The same dryness also seen in lungs and bronchia, which causes dry, hard, racking cough with scanty expectoration. Cough aggravated from motion coming from open air to warm room and after eating also. There is soreness and pain in the chest when patient coughs. In natrum sulph, there is loose cough with soreness. Here is the difference from Bryonia and natrum sulph. As in pulsatilla, so in Bryonia, the leading characteristic lies in its modality, that is aggravation from motion. Now question come in mind, what is aggravated on motion? So the answer is sufferings of almost any and every kind, all the aggravation from motion. Example like any joint pains, chest pain, headache, etc. It makes no difference what the name of the disease. If the patient feels greatly relieved by lying still and suffers greatly on the slightest motion, and the more and longer he moves, the more he suffers, then Bryonia is the first remedy to be thought of. Another very valuable modality of Bryonia is amelioration from pressure. That is, patient wants to lie on the painful site or parts. That is opposite of belladonna and calicar medicine. There the patient is not want to lie on painful site. Here we can differentiate belladonna, calicar and Bryonia. Bryonia has also a very good effect upon the serous membranes. It is useful mostly in the second stage of inflammation, after the stage of serous effusion has set in. In most of these cases, first stage is covered by such remedies as aconite, belladonna, ferrum phos, etc. The pain of Bryonia is very characteristic. In Bryonia, stitching type of pains are seen. As the characteristic pains of the inflammatory affection of the serous membranes are stitching in type, this is the reason why Bryonia comes to be such a wonderful remedies in pleuritis, meningitis, peritonitis and pericarditis, etc. Only one remedy can equal Bryonia for stitching pains, that is calicarbonicum. The Bryonia stitches pain come on an aggravation by the least motion, but the stitches pain of calicar will occur whether the patient moves or not. This will help to differentiate between calicar and Bryonia very easily. Now we will discuss the difference between Bryonia alongside of nux vomica and pulsatilla for different disorders of digestion. All three remedies have a sensation as of a stone in the stomach, but Bryonia and nux vomica have more than pulsatilla. In case of Bryonia, the thirst is more, that is large quantities of water, as the mucous membrane is dry in Bryonia. In case of nux vomica, the thirst is very less than Bryonia. In pulsatilla, thirst is little or none. In case of Bryonia, bad taste in mouth is seen, that is bitter in taste. In case of nux vomica, taste is sour, and in case of pulsatilla, taste in mouth is also bitter like Bryonia. In case of Bryonia, aggravation of nausea and vomiting are worse on motion as rising up, and in case of nux vomica, aggravation of nausea and vomiting in the morning and after eating, and in case of pulsatilla, aggravation of nausea and vomiting in the evening and after eating. In Bryonia, causes of gastric troubles are due to dietetic errors, especially when warm weather sets in after cold. And in case of Nux vomica, causes of gastric trouble are due to overeating, abuse of drugs, tobacco, alcohol, etc. And in case of Pulsatilla, dietetic errors are due to from rich fatty food, ice creams in excess, etc. In Bryonia, diarrhea aggravates in morning and movement and also after overeating. In case of Nux vomica, diarrhea aggravated in the morning, and in case of Pulsatilla, diarrhea worse in night with rumbling of the bowels. All these three remedies have white coated tongue from time to time, but there should not be much difficulty in choosing the right remedy in any case if we consider the cause of gastric troubles, their temperament and modalities. This will surely help to differentiate Bryonia, Nux vomica and Pulsatilla very easily. So far as temperament is concerned, Bryonia is like Nux vomica. Both are easily irritated or angered and aggravated generally on motion. But aggravation on motion is more in Bryonia than Nux vomica, where in Pulsatilla, amelioration of motion is seen. This way we will differentiate between Bryonia, Nux vomica and Pulsatilla very easily. These are some general peculiar characteristic symptoms of Bryonia we seen that helps in selection of Bryonia in a better way. Thanks for watching my full video. Please like, share and subscribe to my channel to get more videos. Thank you.